Blood is the vital fluid that flows through us and sustains every organ in our body. We often take it for granted, like the beating of our hearts, until we become sick and need surgery. Then, the issue of blood transfusions may often arise. Today, many patients are clamoring for safer and more effective options than blood transfusions that may be risky and often unnecessary. In this operating room at Englewood Hospital in New Jersey, you're seeing the future of medicine, and it's called patient blood management. Englewood Hospital and Medical Center in New Jersey has pioneered the use of state-of-the-art medical and surgical techniques which virtually eliminate the need for blood transfusions. It's a dramatic advancement in patient care, and it benefits nearly every single one of its patients, even those undergoing major medical and surgical procedures such as open heart surgery or cancer therapy. Since 1994, the Institute for Patient Blood Management and Bloodless Medicine and Surgery has led the medical world with its groundbreaking vision.
The blood management program initially got started at Englewood Hospital because we were approached by a group of patients who really were not receiving even standard care because of their refusal of blood transfusions.
By taking on the unique challenges of the Jehovah's Witness community, Englewood Hospital quickly established itself as the leader in patient blood management. Dr. Aryeh Shander, Executive Medical Director of the program and a pioneer in the field, says providing surgical and medical care without administering blood forced Englewood physicians to blaze new trails.
To me, bloodless medicine and surgery is a two-way street. On one hand, we are willing to commit to care for this community. At the same time, this community has advanced medicine in many ways because of their refusal for transfusion, and has changed the face of transfusion medicine as well as blood conservation for all patients, not just for the witnesses.
Here at Englewood, the data speaks for itself. Patient blood management offers meaningful benefits for patients: shorter hospital stays, faster recovery, less risk of complications, and fewer post-operative infections. Englewood became the first hospital in the country to offer blood management as a standard of care to all its patients. And those who refuse transfusion under all circumstances can be confident that their wishes will be documented, understood, and respected, whether expressed verbally or in writing.
The application of blood management is not limited to just surgeries that you can plan months ahead of time. They can be used both in emergency and in elective situations.
The patient, in many ways, has to be recruited into decision-making, and that many patients find that very desirable. So it's a multi-modality approach, including the patient in many of the decisions that are being made, which I think brings you to a higher level of decision-making. It's not just the practitioner making the decisions alone.
Patients have traveled to Englewood Hospital from almost every state in the U.S. and from numerous countries throughout the world to receive care in a safe, progressive, and compassionate environment.
We have people traveling here from around the world to learn what Englewood has done, to copy our successes. We found that people from 40 different countries have visited Englewood, and we're training physicians from other countries in the way we care for patients, and they're bringing that with them back to their homeland and using that. So we've had a lot of international successes in our patient blood management area.
15 years have passed since we began the program, and it is amazing to me to see how far we have gone. We have become the center, I believe, of the education and training for physicians and allied personnel for managing blood conservation.
My family and I, we have trusted Englewood Hospital for many of our surgeries because we're Jehovah's Witnesses, and we don't accept blood transfusions, and we know what's available here in Englewood. We know that they have the equipment that can treat us without blood, so we feel very confident coming here.
Englewood Hospital has been recognized by federal, state, and local governments, as well as numerous public and private institutions.
For the 11th year in a row, Englewood Hospital has the most best doctors as picked by their peers. We believe The teaching is certainly a part of that, why those excellent doctors want to practice here. Bloodless medicine and surgery plays a role in that as well.
We were looking for a hospital that would give us good care without using blood, and because we know the risks are so high in having a blood transfusion.
Today, nearly all surgery at Englewood Hospital is performed without blood transfusions, and patients who decline blood transfusions are sure to always have their wishes respected while under the care of Englewood. This includes the most complex procedures, including cardiac, vascular, gynecologic, urologic, and orthopedic surgery. The outcomes are impressive. Patients at Englewood Hospital have lower complication and mortality rates than comparable patients in other institutions, thanks to high quality, safe and effective alternatives, and a shared vision between hospital and patients about blood management.